everyone. My name is Katie Bueno. I am a technical trainer and consultant at a small consulting firm called HealthDataViz. We have been collaborating and working with DC Health a lot recently, putting out some dashboards and data visualizations. One you might be familiar with is the FASTER dashboard that is currently up, and we are working on getting the NVDRS and SUITRS dashboard up, as well as working on an opioid dashboard. So today we are going to be learning about data visualizations. I'm going to share my screen real quick and get into presentation mode. All right. And so the purpose of today's training from my end is to help sort of give you those defining pieces of information to understand and create successful data visualizations. Here at HealthDataViz, we are folks that have been working in this field for many, many years. We have a book that you can actually get on Amazon. Some folks I know at DC Health has this book as well. But this is all about visualizing health and healthcare data. So we've taken our years of experience and put it all into one really important book. So we are going to be sharing some of those pieces of information today. Now, when we talk about data visualization best practices, this just isn't these best practices that we came up with because we thought it was something that we liked personally. This is rooted in many, many years of research of how our brains and our eyes and just how we sort of take in and process information. So we always like to call out Colin Ware. He is one of the foundational individuals to have taken the science of what it means to visualize data and how we intake it so then we can create these data visualization best practices. So here are some best practices to communicate your data. Getting a little sciencey just for a quick second, because it does really help inform why we do visualizations the way that we do them. We have found through our research that 70% of information is taken through our eyes, but only 5% of that is processed by our brains. So knowing this, we need to take that into consideration to be able to create these data visualizations where an individual can quickly and easily understand what you are presenting to them. So we're going to do just a quick little exercise. I would like for you all to look at these lists of numbers and tell me how many number 5s do you see? You can just put that in the chat. All right. Brenton said 5. Anyone else? Robin says 4. Endrin says 3. Leah says 5. So we've got some like difference, and Simon says 4. We have some differences here, right? And what happens here is first, what does our brains have to do in order to get the count of the number 5? First, we're looking for the shape of number 5. We're going down the list. We're then having to remember, okay, how many number 5s did I just have? Okay, I have 1, 2, 3. It's taking some time. So think about this when you're describing and displaying data. If you're sharing a bunch of numbers, the story isn't going to pop. It's not going to be easy to understand. So just by doing a quick little change here, where I have highlighted the number 5s by just making them a different color, we can quickly see in like 2 seconds that there are 5 number 5s. So knowing how our brains work is going to be super impactful for the decisions we make for our data visualizations. And so this is called iconic memory. You may have heard the term preattentive processing or the use of preattentive attributes. This is sort of that gold standard of what are ways in which I can allow my users to quickly identify something that's different? Our brains are always looking for something that is different, and our eyes are helping our brains take in that information. So knowing about preattentive processing, we utilize preattentive attributes to highlight those information points that are important. We can use form like length or width, orientation, maybe having something that's a different, Level, size, shape, enclosure. Color is huge with data visualization. A lot of the times you'll see a different hue or intensity, like we did in that last exercise, even position. So, knowing this, that our brains are looking for something that is different, we are going to use that to leverage our data visualizations. Here's another example. We look at this text table here and we ask ourselves which sponsor for which year had the highest enrollment in drug studies. Just like we did in the exercise, I would have to look through each of my sponsors, check the years, and then hope that my brain remembers that last number that I had taken in, right? So, what we can do to help a simple text table like this is adding some color in a way that's going to help our users identify those highest number of enrollments. So, I can quickly see here that in 2011, the sponsor GSK had the number highest of enrollments. I didn't have to take that time to look for that information. So let's first talk about colors in a way that I think is going to be really important for us when we're sharing our visualizations, especially if we're doing this for our public audience. One thing to take note is that approximately 1 in 12 males and 1 in 200 females are colorblind, and most specifically are the red/green color blindness, which is the most common. So, in this example of these apples, we see the red and the green apples. If you have color, do not have color blindness, but if you are experiencing that, it all looks yellow. A lot of the times, we use the color green for good and red for bad. Unfortunately, someone who is colorblind is not going to be able to discern those two colors. Here's an example of some text tables. We see the traffic light colors a lot in data visualizations. And again, if you are colorblind, it's going to be difficult to discern these colors. So, whenever we are creating data visualizations, we primarily use a tool called Tableau. They have a colorblind palette in there, and those have more of the blues and oranges, which can be discerned by folks who are experiencing color blindness. So taking that into consideration when we're deciding what color should I make something, right? So other than making sure that our color choices are ADA compliant, that everyone can see them, we also need to make sure that we're using color so that it imparts meaning. So we're leveraging that pre-attentive attributes, but we're also ensuring that it makes sense, right? We want to highlight and ensure that our individuals are able to discern what is different. So, for example, here, can someone tell me what the colors represent in this bar chart? Right. It's just saying each bar here is representing a year, and I'm just going to give it a color, right? And sure, this is fun, this is pretty, this is, is kind of exciting, but we're not really using color right now to impart meaning. I don't think every year of the bar chart should have its own color. I can tell what year it is because of the labels that are at the bottom. So if you have, let's say, a bar chart like this, you can just simply keep it one color, right? Because that's really not necessary to give a individual color to each year. Or we can even add some pre-attentive attribute very simply by color coding the year that had the highest percentage of obesity. So, some small changes that you can do to help your data visualization. Even here, another example, we're using color to impart meaning. The chart on the left has so many different colors, it doesn't have a meaning to it. It's making it difficult for me to understand, well, what am I really paying attention to? And let's say I'm, looking at this data and my practice is practice F. I really want to know, okay, what's going on with my practice compared to others? I've highlighted that piece of information so that I can focus on that and then maybe make some comparisons in the other pieces of information in the chart. So, other than color being something that we kind of see when folks are trying to create data visualizations and they may get that wrong, there are other things that we have noticed when we want to ensure that folks are creating data visualizations that are going to be easy to understand. So, here are some simple redesigns. Right now, I have a bar chart and I'm looking at the percent of adults with the common chronic conditions by region. And the problem here is, although I have given color to impart meaning in the sense that these colors represent the different regions that I'm looking at, the problem is that there are so many bars here and I have a color legend. I kind of have to go back and forth to say, okay, what does purple represent? What does this blue represent? And it's going to take a little bit of time. Again, one of the things that we want to remember when we're creating data visualizations is we want the answer to be quick and easy to understand. Folks have very short attention spans nowadays, right? We've got TikTok and we've got Reels, and everyone wants information quickly. They don't want to spend too much time. So for here, I improved this bar chart by first changing the orientation of things so it's easier for me to be able to view my different regions. And I don't really have color to distinguish the different regions because I'm now able to use those labels and directly have my eye go across and get to that information a lot faster. Another example, folks love to use pie charts, donut charts, and although they might be fun to maybe break up the different types of data visualizations you are sharing, pie charts are kind of difficult to understand their size, right? Their orientation here. Like it might take me a second to figure out, okay, what's the biggest slice or the smallest slice, and by how much, and it's going to take a little bit more thought process, right? So I say pie charts, maybe 2 to 3 slices at most. If you get more slices, things get lost in the sauce. Everything that is a pie chart can always be better in a bar chart. With a bar chart, I'm able to quickly identify the length of the bars of, okay, which one of these pairs here has the highest value. And I can quickly identify that it was private health insurance. And what's pretty cool with bar charts is you can always add reference lines to be able to have that form of comparison. You can't really do that with a pie chart. With these pie charts, you also don't have a lot of space for the labeling of what it means, so you may have to have a color legend. So here's a great example of how you can improve a data visualization by making it just a little bit easier. A multiple stacked bar. Again, this is going to take a long time for me to understand that sizing of those bars and having to go back and forth between the color coding. Sometimes it's best to just break things out a bit. So, a way to improve this chart would be to create more of an individualized bar chart and using sort of this interesting stacking of bars where I'm able to show if it's, hitting that 100K or not and how much it is being taking up of that bar chart. So, taking these things into consideration, we're going to do just a quick exercise where we're going to look at some chart junk. We're going to see, what's kind of wrong with these data visualizations and maybe how can we improve it. So, looking at this chart here, can anyone in the chat or you can go off mute just tell me what are some things that are wrong with this data visualization? What's not working here?
Honestly.
Exactly. The colors are difficult to discern. Using 3D is making it difficult to even understand what those values are. There's also so much color on these visualizations. You have the kind of pink color for the background, and then you have orange for the title, and then it's just so much is going on that our eyes don't really even know where to look. It's almost overwhelming. Any feedback on, let's say, this visualization? What do you think is wrong here? Definitely. Like with this pie chart, it's so hard to identify, like, really what is that difference between each of those slices. The pie chart limits us to the labeling of things. So we have to result to having a color legend, which is going to make us have to go back and forth. Another good example of what not to do. Anyone have any critiques on this visualization? And
I
this
don't
is this is
I
and
don't
this
know.
is actually a visualization that's been published, put out there, right? And so it's just an interesting way in which folks maybe think that a pie chart can be used to not add up to 100, right? That's the whole purpose of it. I want to know the percent of a whole. You never want to use a pie chart that's showing these slices like this. And because these are such small differences, it would be so much nicer to be able to see this in a bar chart, right? The differences here are hard to really discern unless you're looking at the labels, and the labels aren't really that helpful. And one last one, anything that you can see here that's wrong with this visualization? That's the thing, is that sometimes we feel like we have to show everything all at once, and it's always best to break things out and slowly kind of give this information to a user. maybe having some more information about what it is that these visualizations are presenting, avoiding these traffic light colors. And we see here the red and the green, which is not colorblind friendly. We have such a dark background that it's kind of difficult for us to even see the numeric values of the green and the red. There are a lot of great resources out there for you to check color blindness to see if what these colors would look like to someone who is experiencing color blindness. There's also like a certain percentage of you want the difference between your text and your background color. You can always test that to see, is that ADA compliant? Is it AA, AAA, things like that. So it's always important to think of that end user and imagine how they are going to approach a data visualization, and how can we describe this information in a way that's just a little bit easier to understand. So thank you all for, yes, I see in the chat too. Thanks, Megan. Thanks, Alejandra. Yeah, there's no focus. Definitely not. Okay, so we've seen some things that are, not so great. We're getting the hang of what to look out for. Now, here are some examples of some successful infographics, because I know we've heard some of you do tend to create some smaller sort of charts and share them out. So I want to show you some successes. So a lot of the times when we think of infographics, some folks confuse that with an info poster. So when we think of infographic, we're not so much about giving information such as the stop of the spread of germs. We're trying to give a snippet of information so that an individual can take it and run with it and maybe, take some action. So here's some tips for creating an infographic, okay? So one thing I'd like to tell folks, if you're going to create a short little infographic or even a dashboard, I know folks here on the call may not be doing that, but it's also just good information to take into your back pocket, is use a graphic organizer to try to decide what's the point and what's the story. A graphic organizer can literally be a pen and paper, and you're starting to draw things out on a paper to kind of put it all out there to say, am I capturing the information? Am I telling the story, right? You can always use some free sort of programs out there. Figma is one that I know has a free version of it, even Canva, kind of just creating an organizer of what you intend to put on your graphic. Now, making sure that you're defining the outcome, right? What do you want to do? Do you want to raise awareness? Do you want to teach? Do you want to persuade? Do you want to move to action? Deciding what that outcome is going to be is going to really help you with your narratives and decide what you should have on the page. Identifying the problem or the story, right? You want to define the problem or name the story to be showcased, making sure you have a title that really indicates, okay, this is what we're talking about and why. Then you also want to ensure that you are bringing in information that's not just something you got off of a website that isn't reputable. You want to make sure that you are researching the data. You're making sure that it's truthful and it's coming from reputable sources to sort of further indicate the information that you are trying to share. And last, it's always nice to have a sort of summary or call to action when you're creating an infographic, especially if your outcome is to persuade or to move action. So kind of allowing users to understand, okay, what can I do next to make it clear as to what they can do and how they can do it. So here are some examples of some infographics that I created, and I put it out during the National Public Health Week, where each week had a different theme. This one is just talking about, location and why that matters. And so I created a data visualization where I first kind of described what is going on. I created a title that really indicated the purpose, the story, right? Life, death, and location, why your address matters more than you think. As folks in public health, we know that if you live in a certain zip code, your life expectancy might vary very differently compared to your zip code next door, right? So we talk about, what is determining that? The social determinants of health, those factors that can place a higher risk on your mental and physical health, and indicating those things in a data visualization. Here's another example where we have mental health matters. What is going on here? We see that 1 in 5 adults experience mental health illness. And we talk about it, not just giving these visualizations on their own, but we want to provide more of okay, approximately 1 in 6 youth even have a mental health condition, and we want to identify the problem, right? And so these are ways that you can share simple graphics. There's not a lot going on the page, but there's also that substantive information in a text format that's highlighting the main problems that we want to address and inform our audience on. Here's an infographic that I made for DC Health. This is probably coming out soon, where we're looking at homicides and a comparison between DC and other major cities in the US. And we take that information, we put it in a graphic. And here's a good example of I might not have wanted to put too much information to a user. So for this, if you click on the dashboard information, a pop-up window comes where you kind of have more information about what you're viewing, why it's important, and things like that. So those are just some tips in order to ensure that your data visualizations are going to be impactful and ensure that folks are able to identify the main reason and purpose of the visualization. So to end this, I wanted to kind of give some data visualization development tips. One thing that we always have to do is we want to empathize. We work in public health, so of course we have empathy for our end users, and we want to make sure that they're able to see themselves in the visualizations that we are sharing. We want to ensure that their experiences, their needs, and behaviors are going to be captured in the data that they are looking at and maybe taking in and using for reports. Of course, we always want to define very clearly what the problem or the objective is. We want to ideate, so we want to generate diverse solutions so we can do some brainstorming, some sketching. Even if we're going to put out something very simple, we can talk to each other and ensure that we are creating something that is impactful. Prototyping, like I talked about, using a pen and paper, coming together and maybe using a whiteboard and ensuring that all of our ideas are being defined in our visualizations. And then even testing it out. Maybe prior to putting this out to the public, you may want to share this with some internal staff or folks that will be viewing and looking at a visualization and ensuring that they feel as though the visualization is meeting their needs. So to take this and wrap this all up, to have the foundation of DataViz best practice, we know the way in which our brains work, right? We understand that 70% of what we take in and the way that we process it is through our eyes. So we want to use those preattentive attributes to identify those pieces of information in our visualizations. We want to understand the use of color, right? Making sure that it imparts meaning and that it can be viewed by anyone, regardless if they have color blindness or not. We want to make sure that we're reusing some chart types that are done well, right? Avoiding those pie charts with a bunch of slices that require that color legend and maybe going for a bar chart. And then also just understanding the limits of our short-term memory so that we can optimize the way that we are displaying things on a screen so that folks can quickly and easily identify the story of the data. So that is all that I have for you all. I hope that this was helpful for understanding data visualization best practice and looking forward to any questions that we may have. Thanks.
Hi, everyone. We talked about data visualization, so how we process data using our eyes. So now we'll go into how we process information using our ears, right? Very basic of it. So it's leveraging data to enhance health literacy in your community, a storytelling approach. So what I'll be talking about is just the art of storytelling, integrating data into storytelling, and then crafting compelling narratives, and then obviously overcoming challenges. So what is storytelling? I can tell you what my definition is, but I'd love to hear everyone else. Like, what do you think storytelling is? And just unmute yourself and shout it out. So for me, storytelling is just, it's a part of the human experience. We share stories every day, every single day, and we label it different things, right? So whether it's telling someone about your day, or telling someone, sharing with them this place where you got a beautiful dress and you got it at a discount price, or sharing that you got a new job and that you're leaving. we are constantly sharing stories. So the very act of telling a story in and of itself makes people trust you more. And as I mentioned before, it's just part of our daily interactions with others, but it's also part of daily interactions that we have individually. So I don't know, you all raise your hands, but how many of you are on your phone watching TikToks or watching Facebook Reels? Or you stayed in your car a little bit longer than you should have because someone grabbed your attention with a story, right? Something that you didn't even think you were going to be into, but they captured your attention and you stood there, in the restroom or wherever it is, just listening to the story. So, what to me is also impactful, besides the fact that we are doing this every single day, is that stories activate different parts of our brains that data alone do not, right? So data in general, that is great, but it doesn't change behavior. Emotions change behavior. And to me, what's interesting is that our brain, as Katie had mentioned before, it plays an integral role in the information that we process and in the information that we share. So the brain's preference for stories over pure data stems from the fact that it takes in so much information during the day. And so it's important for it to determine what's important to process, what can be discarded, and a story can make the difference on whether you're going to keep this information or not. So some parts of the brain, and you should look this up. I've listened to a lot of TED Talks about this, but even in my work, right, as a public affairs communicator for DC Health, um, sharing stories is it's a profession. It's how we enact change in others, or we try to enact change in others. So, for instance, parts of the brain that are activated when you're, well, let me go on to actually, I'll finish it up. But some parts of the brain that are activated when you're sharing a story include the areas of the brain that deal with language comprehension. Your amygdala, which processes the emotional response. And the mirror neurons, which play a role in empathizing with others. So these are all parts of the brain that are activated by the mere act of storytelling. So what goes into a story, right? So we all pretty much know the basics. We go to the movies, we watch TV. So it's about the characters, the context, the conflict, the plot, the climax, and the closure. So parts of sharing your story, especially in your work, is setting the scene. So what's the scene? Where are we? What community are we serving? What ward are we in? Who are the people that this story includes or impacts? In regards to the climax and the personal transformation, what's the problem? What's the issue? What needs to get resolved? What's the personal transformation? And these can all come down to obesity, diabetes, heart health, the environment. And then finally, what's the resolution? How are we going to address this conflict or give closure to this story, or talk about the life lesson? So these are all parts of creating a compelling story. So we have data, right? However you collect your data, whether you're collecting it, whether you're sorting through it, it can be overwhelming, right? I love this visual because it's Legos, right? Imagine just a big pile of Legos, all different colors, and you're looking at it and you're thinking to yourself, oh my God, what am I going to create with this big stack of colorful Legos? Um, so you have the data, you go through the Legos and you decide to sort them out. You arrange them however you want to arrange them, but then you can create a story with the data, which the Lego pieces represent. So what story are you going to share? What's going to be compelling and how are you going to make it interesting for the audience that you're creating this story for? And at least in our field, right, we're talking about data and how this data communicates the social determinants of health. That's what we do here at DC Health. That's what you're doing. How are we going to communicate all of these stories that we encounter? And you all receive stories. When you're out there talking to people on the street or trying to get people to come to your workshops, you're sharing a story or you're listening to a story. You know, I'm going to come to this workshop because my grandma, she has diabetes, and I think that it would be good for her to learn about some of the programs that you have. So you're collecting these stories from people on the street or people that walk through your door. How are we going to use these stories to talk about the work that we're doing and the impact that we're having in our communities? So when we're talking about integrating data into storytelling, it's all about finding the story within the data. So you have all of this data, but it's useless. It's pointless if you can't find the story. Like, what does it say? And then obviously consider your audience, right? We talk a lot about using plain language. So we're not necessarily going to use like these complicated pie charts, right? But we are going to use simple language. Like, did you know that 1 out of 4 people have X, Y, and Z? So you're considering your audience and how they process data and how your message is going to be most effective with them. So that goes back to determine what data matters. You yourself, before you start sharing your stories, should be analyzing this data to find the insights. And then identify the most effective data visualizations, as Katie was talking about, and provide context. What context are you giving this information or providing this information for? And then using all of this, you're going to structure your story. And obviously, you want to make sure that that you're capturing people's attention and that the story is clear and concise. You don't want to overcomplicate the story. You don't want the story to be too long. So even when we create videos or uh, messages that we're going to post on social media, we know that people have very short attention spans. And so we're not going to create something that's 5 minutes long. We're going to create something that's about 30 seconds long because we know that that's enough time, hopefully, even with our Living Well ads, that's going to be enough time to get someone's attention and then have like a call to action so that we get people to either go to a website, learn more about their health, join up for a program, attend a workshop. And as mentioned before, data doesn't change behavior, but emotions do. And by using the data while we're sharing the story, the hope is that we want to make better informed decisions by using this data. And with the data and with the story, we're using storytelling to solve problems. So I'm going to share with you all this graphic that we created. Well, actually, let me see if I can share it in well, when you take a look at this, what's the story? I'll give you a couple of seconds to look at it. So it talks about HIV and AIDS and STIs in DC. But there's one thing on here that sticks out. Well, there's 2 things that stick out, but go ahead and shout it out when you see it. And tell me if it's too small. It might be too small. So when you're taking a look, that 183% increase in primary or secondary syphilis in women from 15 to 44 since 2016, that's a big number. But as you also mentioned, the cases of HIV are going down, but there's still work that needs to be done. But that's the story that once you have this data, now that you have these insights, what are you going to do with it? This is a visual representation of it, but how are you going to share a story about this? So I'm going to give you an example of crafting a story with data. So I'm going to use the case of diabetes, right? So unmasking the silent epidemic, a data-driven journey through diabetes in Washington, D.C. In the heart of the nation's capital lies a silent epidemic, silently impacting the lives of thousands. Diabetes, a complex and often misunderstood disease, has woven its tendrils through the fabric of Washington, D.C., affecting individuals and communities in profound ways. By delving into the data, we can unveil the true scope of this issue and illuminate paths toward understanding and action. The burden unveiled. Our journey begins with a stark realization. Diabetes is more than just a health issue, it's a socioeconomic one. In Washington, D.C., the prevalence of diabetes is disproportionately high among minority communities and those with lower socioeconomic status. According to data from the D.C. Department of Health, African American and Hispanic populations are nearly twice as likely to develop diabetes compared to their white counterparts. Furthermore, individuals living below the poverty line are significantly more vulnerable to the disease, highlighting the intersection between health and socioeconomic disparities. So the ripple effect. The impact of diabetes extends far beyond individual health. It reverberates throughout families, communities, and the healthcare system at large in DC. The economic burden of diabetes is staggering, with millions of dollars spent annually on treatment management and related complications. Moreover, diabetes-related hospitalizations and emergency room visits place immense strain on healthcare resources, exacerbating existing challenges within the healthcare system. Charting the course forward. Despite the daunting challenges posed by diabetes, there is hope on the horizon. Through targeted interventions and community-driven initiatives, we can begin to reverse the tide of this pandemic. One promising approach is the expansion of access to preventative care and diabetes education programs, particularly in underserved neighborhoods. By equipping individuals with knowledge and resources to manage their health effectively, we can empower communities to take control of their well-being and reduce the incidence of diabetes. As we conclude our journey through the data, one truth becomes abundantly clear. The fight against diabetes is multifaceted, requiring collective action and unwavering commitment. So by harnessing the power of data to inform policy decisions and to allocate funds and resources and drive community engagement, we can pave the way toward a healthier, more equitable future for all residents of Washington, D.C. So this quick narrative in regards to diabetes in DC weaves together some data points, and it personalizes the issue and emphasizes the need for action, creating a compelling story that inspires understanding and advocacy. So again, it goes back to using storytelling to solve problems. And it points out that data is very powerful, but data alone does not create movements. Stories do. So when you think about your work, how are you communicating the work that you're doing? How will you use data to move forward this message and to create change? At the end of this, I'm going to share a little activity that we can all do. But we talk about story sharing. However, there are challenges, right? And we became aware of these challenges during the pandemic. So there is a thing out there called health misinformation. So these are some of the graphics that we posted during the pandemic to kind of combat misinformation. So what is health misinformation? It's false, inaccurate, or misleading information according to the best available evidence at the time. Oops. We posted this up about spreading the truth and not the virus. So again, it's about how we're sharing these stories and making sure that we're sharing stories that are not misleading people, because misleading information can really lead to some dangerous decision making. And it goes back again to creating this narrative and this story to make, well, using data to make well-informed decisions about your health, or it really could be anything, buying a home. And part of the campaign in regards to misinformation was why do we like to share misinformation? We like to share misinformation because we want to be the first. We want to be the first to share something, right? But it just goes back to when you're sharing, and especially when you're dealing with data, where are you getting your data from? Oops. So some of these, oh, here we go. Trusted sources of information. Obviously, I saw that Katie had some of these up there from the CDC, from NIH, or even just doing some basic research on this information. So you're ensuring that you're not misleading people when you're sharing your stories. But when you're tackling this misinformation, you just have to make sure that you're listening to analyze this misinformation that's been circulating throughout your community, that you're engaging and listening to your community. A lot of the times people want to be heard, right? They want to share their stories. So we're these creatures that like to share stories, but we all want to be heard. And it's about sharing accurate, clear, and easy to find information by using some trusted messengers. And when we say messengers, it's using trusted storytellers. We're all storytellers. Some are assigned storytellers at our organizations, but this all just goes back to what are we doing with the data? How do we want to affect change in our communities?